This is Dr. Leedia, and it is my honor and pleasure to introduce Dr. Mark Goldenberg.
Thank you so much for having me, Dr.
Thank
Leedia.
you for being with us. Dr. Goldenberg is a pediatric dentist. It takes a special soul to be a pediatric dentist. Pediatric dentist is a dentist that sees solely
Takes
children.
care of children. And we think of ourselves as having special souls because we get to treat kids with special souls. We take care of kids from birth on almost through college. So we watch the kids. I have kids who are in college who don't want to leave our practice.
That's hilarious.
Sometimes we have to kick them out and say, you graduated from us. But we get to take care of kids and watch them grow together with their families, with their siblings and their parents, and try to direct them to a lifetime of good dental health. So, and you have to want to work with kids. That takes a little bit of the challenge. And we as pediatric dentists have the experience, the knowledge, and the background and education in treating these kids.
When should a mom or a dad bring their child in
All of
to
us
see
as
you?
pediatric dentists and our professional organization known as the American Academy of Pediatric Dentistry recommend that as soon as a tooth erupts into the mouth, their first tooth comes in the mouth, it's a good time to come visit your dentist and hopefully a pediatric dentist. And we expect to see teeth at about 6 to 8 months, but certainly by a year of age, by 12 months, you should establish what we call a dental home, a place where you're going to go for all of your dental treatments and advice and knowledge and education. So we want you to come. So I would say certainly between 6 months and a year is a good time to come to the dentist.
How should a caretaker be taking care of an infant's mouth prior to the teeth coming in?
So the caretaker, meaning the mother, the father, a nanny, anybody who's taking care of the child, even though there aren't any teeth at that point, it's the best to get in there and try to swab the gums. Get in there with a soft washcloth. They have swabs that you can get professionally, and get in there and wipe down the gums gently, the top and the bottom. And it removes whatever kind of foodstuffs and other things and bacteria in the mouth. And it also gets the child used to somebody being in there and doing a little bit of cleaning so that when the teeth do ultimately come in, they're used to that, and they'll be used to toothbrushing, which is so important.
When they're transitioning from swabbing to toothbrushing, what do you what kind of toothbrush do you recommend a mother or a father to be using?
We like them together. There's so many toothbrushes out there that you can get. A soft children's toothbrush is what we recommend. Nothing hard, a soft children's brush. And it has a little head on it so you can get into their mouth. Nowadays, there are brushes with every kind of character, every kind of color, every kind of shape that you like, and there's electric toothbrushes. Yes. And parents ask me, electric, non-electric, and my feeling is you've got to get the toothbrush in the mouth and on the teeth.
That's all that matters.
Electric, if it's manual, you're going to be in there, get the whatever plaque is building up on there and get it nice and clean.
Toothpaste,
the $1 million question. Everybody asks about toothpaste. And we as pediatric dentists say they should use a child's toothpaste that has fluoride in it. Fluoride is a naturally occurring element in nature, so it's not something that's added that's artificial. But what it does is it helps reduce cavities. It makes the enamel stronger. So we have it in toothpaste, we have it in water supplies, we have it in supplements such as in various vitamins, and it can be given that way. But we want them to get some fluoride. That being said, when a child first gets it, just put a tiny little bit, like a little smear. That's
for my daughter, I
just
put
that little,
tiny
because kids swallow toothpaste till about 5-6 years of age. So they're going to swallow some. But if it's that much, it's not gonna harm them. As they get a little bit older, a little pea-shaped amount on the toothbrush, till ultimately when they get older and they know how to rinse and swish, that you can put a little bit more toothpaste on it.
What about the dosage of the fluoride? Should we just trust whatever's in the toothpaste, brush their teeth a couple times a day?
If you're careful with it, the amounts that they put in there are certainly safe dosages.
Yes.
And it's like any kind of medication. You take, the right amounts, it works.
Therapeutic.
Anything you take. If you drink too much water, if you have too much table salt, it's no good. So it's like everything in life.
Absolutely.
Everything in moderation and in the right proper dosage. And the benefits has been shown to be far, far greater than any of the risks.